as far as each subtype. So when it comes to the limited scleroderma, what is unique to this subtype is called calcinosis. And this is because the damage that is going on in specific parts in the body, some calcium can build up in the wrong places and it can turn into a crystal. Now, it can also make these little hard knots like in the inside or right underneath the skin. And what happens is sometimes these little bumps can actually go through the skin and kind of erupt. And at that time, what happens is this chalky material comes out, and patients will get these sores that just kind of never heal. The other thing that is unique to the limited scleroderma is they can get telangiectasias, meaning that they can get these pinkish red spots on the skin. They're flat, they're not bumpy, but basically you can see abnormal blood vessels through the skin of the patient themselves. The third thing that limited scleroderma patients get more is called pulmonary artery hypertension. And this is basically a fancy word for saying that the heart is working too hard. So the blood pressure is high inside the heart, not in their arm, but inside the heart. And limited scleroderma is also known by an acronym CREST, C-R-E-S-T. And basically CREST stands for C for calcinosis, R for Raynaud's, E for esophageal dysmotility, S for sclerodactyly, and T for telangiectasias. Now, when it comes to the diffuse scleroderma, what's a little bit more unique to them is that they can get the skin thickening all over the body instead of just one place. And they can get some autoimmune lung problems or some lung problems in general, basically because there are certain parts of the lung that can kind of get thickened or can get diseased. They can also get what is called renal crisis. And basically, this is where the blood vessel that's going to the kidney clamps down or becomes very narrow, just kind of like the vasospasm that happens in Raynaud's, but now it's happening on the inside. And when this happens, when the kidney doesn't get any blood, because the kidney is so important to so many different things in the body, it actually becomes a medical emergency where the patient's blood counts will go down, their kidney numbers will go down, etc.